In the past, we've had implementers come into the IAT and bring us rendering challenges. We had the group from Texas come under the representation of Catherine Lusk to talk about some of the challenges and the problems that they were facing. And we came up with some creative ideas around things that could be done with the style sheet. But you know, there's more lurking under the surface. Recently, we had a presentation from the VA, a group who did some analysis in the VA, came into structured documents with a presentation. I'll show you a summary of it, bringing some of the ideas and sort of, you know, could we do something better, challenges with it. And then I sit on this group from Sequoia called the Data Usability Taking Roots, a very large implementer community group. And they express frustrations with the inconsistency about how different CDA documents are rendered from place to place, and really just CDA documents not meeting their needs. And so for those reasons, you know, this is the Catherine Lusk slide, this poor unhappy lady struggling to figure out, you know, how she can do a better job, how to do something better with the CDA documents that they're getting. And then the VA's slide, which was about a 5-slide deck where they really went through and analyzed some of the differences and said, hey, what about back to top navigation or displaying some fields that we're not seeing you display? Or maybe even displaying things that are represented only in narrative text, not in a coded value. Are there ways that you can, you know, make some rendering improvements there? These were like baby step asks that they had talked about, but they put the energy into bringing a presentation into structured documents and asking, is there something that could be done to improve the way CDA documents render? So I summarized some of the woes that we have right now. The style sheet doesn't really show enough, it doesn't have enough creative options in it. People want more navigation flexibility. They want narrative text answers to be able to be shown, not just coded answers. And they want all of the information that's in a CDA to be revealed, not just, oh, the style sheet didn't pick it out to be revealed. It's really there, but you know, you're not seeing it. So some of the other things that we know are challenges or woes right now is that facilities or groups, like the example was the group in Texas, where they're like, hey, in Texas or among all of this set of hospitals, we really want to have a consistent way so that if a doctor practices at 3 or 4 different places, that they have some predictability about how the document information is going to be presented. They'd like to be able to control the order of the content that's presented. That's one of the ones that we worked on. They needed a reference implementation for entry-based rendering. A lot of people at the usability group are struggling with this idea that, what do you mean you're only showing me section.txt? We want to see the actual data that's packed in the document. How do we render that? And there isn't a reference implementation to show how to do that. Not enough creative options. For a unique problem that we face is when you ask about relevance and pertinence and what do you want to see, less or more, about 50% of the people say they really want to see more, and 50% of the people say they really want to see less. And so when you have a problem like that, you need to get creative. We also have new applications that are using mobile phones, mobile technology. How do we create views that are more adaptive to the device that the rendering is being done on? And then, as I think it was John Demore who showed the slide about converting the human readable in CDA to the human readable that will be driving section.txt in FHIR documents. What about that? Are we doing anything to render FHIR documents? Nothing so far. So what I wanted to do, we have about 30 minutes. I have 2 spots of gathering participation input, and that's why I kept my slide in this kind of mode, because I've got a whiteboard that's empty and ready for folks to say, from your experience and some of the thoughts that you've had, what are some of these woes? we're going to just give it as kind of a time boxed amount of time, because next I'm going to also be asking to put together what are some of your dreams. So we got to save time to gather both kinds of input. And for now, I would just say, have there been challenges that your organization or some of your customers have brought forward to say, we really wish that CDA documents could render better or differently, or there's some kind of problem? I'd like to add them to this slide.
I think coming up for USCDI V3 assessments, like questionnaires and whatnot, we kind of have to deal with that a little bit as far as how to properly display that information. You have these questionnaires that are common, like PHQ-9. How do you properly show that to where it's pretty much getting the same point across as the document itself would. If you had the paper document in your hand, can you get that same understanding by looking at it in the UI or as a PDF?
Get something similar to the original.
Yeah, can you get the same conclusion? Do you feel like it's the same document or similar? Is it as helpful? Is it equal to the paper document that you are filling out by hand?
Okay, thanks, Matt.
No problem.
Anybody else? Challenges that you had? I don't know if anybody like is Matt S still, is Matt Siskepowicz still on the line? I
Yep,
don't know.
I'm here.
Matt, do your users ever, I know you guys make really beautiful documents, but do you ever run into challenges or frustrations with wishing rendering could be different or better?
Um, I mean, there are certainly like issues we run into. Um, I think one recurring thing that, well, it's not really a rendering issue, so never mind. Um, like as far as I was thinking, the like some users want to see more data and some users want to see less data thing going on. Like that definitely is like just a challenge of CDA in general, is like how much data do you actually want to show to users in the narrative? And that is something we kind of think about often. Um, Another, I think, kind of balancing act that you just kind of always have to strike in CDA is like how dynamic to make your documents. Because if you start just like throwing JavaScript all over the place everywhere, then now your document like loses like static printability, and it loses the consistency that I think you get from having just like, here's a document, you can look at everything in it. And so that is another thing that kind of, I think typically we feel like I'd be a little afraid of like seeing documents do more and more of that. But then the downside of that is, well, now your document isn't very configurable.
Yep, yep. How about the eye care guys, Dennis and
Yeah, Jim,
and
I was
have you guys run into stuff where you're trying to represent complex information? Any rendering
few
challenges you ran
things.
into?
I think you brought it up before, Lisa. One of the things was the ordering, so to be able to have a selective order. So, for instance, when you're sending a referral note, you want the reason for referral at the top. You don't want it kind of way down in the document. So, having some way to order the sections or override the default ordering of the sections. And I think this was mentioned at the last IAT, I thought.
Yeah.
So
Something like that would be useful.
I want to poke on that because of the way you said that. Because you said when you send a referral. So in that case, are you the person creating the document, or are you the person rendering the document on the other side? Because I feel like that's always been an interesting. The last time we had the rendering challenge, that was one of the requirements, was you need to be able to reorder sections. And I mean, that really raised my hackles because the CDA document was, you're supposed to render it how they built it, which would mean the order. And, you know, probably people aren't saying, you know, they create a custom, well, I'd say probably people aren't creating a custom section that goes at the top that is very important for you to read before everything else. Having said that, I know that we did at Epic.
Yeah,
But to let
it's both.
the receiver then do whatever they want means that you could have had something that was important to put at the top.
Exactly.
then
So the
they-
sender, I was talking more about sending. So I mean, you're right. It depends on the context. So right. So when we were creating for Project Claire, we specifically made sure the reason for referral was at the top. But when a lot of people are generating the documents, they don't have any control necessarily. And maybe this is more of an application thing
Yeah,
than
that's them
rendering,
talking
but
their EMR.
yeah. Yeah, so then you're talking about in the EMR, if you don't have the ability to order it, then, you know, for me, a referral should always have the reason for referral at the top. And that's
Mhm.
something that could be defined in the standard, but sure, it can be overridden by the sender. And I
Thanks,
agree with
Dennis.
you. Yeah, the receiver may not be a good choice to be
I mean,
overriding something.
at least with structure definition, we could enforce it in the standard, but
Like
I'm gonna-
optional, you know, yeah.
I'm going to push us on because we're about at the halfway point
Okay.
for this short segment here. So, what are your wildest dreams for rendering structured documents? I'm going to start us off because I do actually have a wild dream. I'm hoping Linda Michelson is still on the line. Linda, if you're taking a nap, wake up because you might care about this too. So, one of the things that I think is really missing is, and this isn't like sort of a general use rendering tool, thinking that every clinician is going to want to see their documents this way, but for us as an industry to advance our work and raise the bar on the quality of the data that's in our documents, I think we need better tools to see what's in there. And so this dream that I have is some sort of I don't know if you remember like the old HL7 V2 viewer thing that had like the four boxes and you could step around, go to a different segment, move to a different area of the segment, and it would show you the fields all laid out. You could navigate in different ways. I was thinking of something that would give us the ability to actually start at the beginning, which is Matt, you mentioned it, like the paper document. We know what it is that we are really trying to emulate. Linda talked about dreaming of a day when she didn't have to get that paper document because the structured document would actually be a good rendition of it. But
Lisa,
yes.
just to correct you, the problem is everything isn't in the C-CDA. In my case,
you wouldn't know if you didn't get the paper document.
Exactly right. The
Right?
paper document is a different form of output of the
Yeah,
record. Exactly.
But
yes.
to me, the goal, like if we were doing a good job, we'd say, look, here's the original discharge summary. We would look at it, we would see what's in it. Then we would go, oh, let's go look and see, is it the right author? Is it the right date? Is it the right patient? Is it the right encompassing encounter? You know, how are those things? If you've got a FHIR version, you could compare these. And then ultimately you'd be looking to say, oh, there's a section that's got these whatever discharge medications. Can I see that there's a discharge medication section?
Images.
And can I, if there's 8 medications listed in this table, can I see that there are 8 medication entries that represent the same information? And then, of course, you know, just like because I'm really worried about how we will smoothly transition to FHIR, I'm like, let's just make it possible to look at that document rendered as a FHIR document and make sure that we didn't lose anything in the translation. This is my dream. I don't know, you know, people like John DeMore are out there making some pretty cool things. He showed you this in his presentation. It's his tool that does that alignment. So you can bring in an object and you get the CDA part over here and the FHIR part over here, and you can actually compare how the entries are representing the same coded content, but in slightly different ways. But you can tick and tie. This kind of thinking, you know, blown up to really give us a useful tool to look at documents in general is something that I'm dreaming of. I just wanted to get you started to feel very free to have wild dreams, and we'll spend about 5 minutes taking ideas here, and then I'm just going to close with a couple of comments to keep us rolling on time. Anybody have other, you know, Linda, I was thinking maybe you had thought about this a while. Do you have wild dreams of what would be better for being able to review CDAs?
So to be honest, the rendering of, you know, what we do now with, we probably customize the style sheet a bit, but is fine. It just, the stuff isn't there. Yeah, you know, it's not in the CDA, so you can't render what's not there. Like the procedure note.
So you don't ever worry that there's stuff in the entry, but you don't see it because you're rendering section.txt.
No one's ever brought that as a concern in their analysis, and they've done quite a lot of it. I always thought the rule was, Lisa, it had to have everything in text.
It
should.
is the rule, Linda, but you know what? There's speed limits that are the rule also. Do we have anybody that doesn't follow the speed limit?
Exactly.
You know, you have to verify that the rules are being followed.
So the machine readable will be there, but if like a client will see the machine readable and say, well, why is it not showing in the document? Well, because you don't have it in the text,
Yeah.
right? That's two different places. If you're talking about wild dreams, I mean, if you're talking about really wild, I mean, you know, what if just AI just reads it all and just, you know, does all the work for me? I don't
There you
know, you know,
go.
how, you know, how wild can you get, you know?
To some degree, there's a possibility there, right? Of looking, I think, yeah, I think there's possibilities there.
Or even, or even if it's not still a good dream, but maybe less wild one, if AI or there was some kind of application that could compare for us the CDA and the original document and indicate maybe what wasn't present. Also be helpful.
Right.
Agreed. Mm-hmm.
You're speaking
Yes.
Lisa's love language.
I can't tell you how many hours as an organization we have spent analyzing that.
Yeah.
Awesome. All right. Anybody have any other burning dreams to share? I have room on the slide for one more if you want to throw one out.
Lisa, this is Jim Gray. I don't know if this fits in this, but one of the things I hear all the time is that the reason that faxes are still sent, even when a C-CDA can be sent, because in the C-CDA, you don't have the context. Like when a provider writes a letter to another provider, they always start saying, this is why you're getting the information, or this is why this case is unique and what you need to pay attention to. That's kind of difficult to do that in a C-CDA. People say, well, put it in the plan, but you write your plan in the context of your record in your chart, and the wording that you use to another provider is different. So it's difficult to do it in the plan.
Talking about a wild dream, what if faxes just get dealt with? Finally. It's not happening anytime soon, but
Cool. All right. That filled up my slide. Super. I did have one other whiteboard, but we're out of time. So I'm just going to go to this springy slide that says, what can we do to nurture these ideas and help them take root, grow, and bear fruit for all? So these are little apple trees that are just getting started here and a mature orchard. I wanted to go to an idea that the CDA management group has been talking about for a while. If you go backwards in time, when we were first really struggling with any other new possible ways of rendering documents, there was a challenge that was run by the ONC in 2016, and many applications were inspired to compete because there was a prize, and the winners, the top 3 winners, got a lot of publicity out of it, and then they created reference implementations that gave a jump start to the rest of the industry. It was amazing, and it really did help. I'll show you a proof point of that. But what about now we're in 2024, you know, almost a decade later, If we got support from the ONC to do it, it would probably be about a decade later by the time, that we could pull something like this off. But is this something that could be considered so that we could produce more open source tools and ideas, stuff that helps everyone do better, raises the bar on how we can see into the documents, whether it's the ideas of see what's missing or see what doesn't match up between the entries and the human readable, increase our transparency to understand if we're doing a good job as we convert from CDA to FHIR, so that we aren't just losing something and really making a mess in that transformation. Maybe it's time to ask for another challenge like this to come forward so that we could bring acceleration to the ideas, to the amount of innovation that's in this really important aspect. We rarely talk about it, but ultimately the value of these documents is perceived by how we can see the data that's in them. And so the rendering part, which often doesn't get talked about, is a really essential part for data usability taking root. This is just an example from, I used to work for MaxMD. They've got some really cool tools that are available on their website, open, free. Under tools, there's this direct CCD viewer. You can take any CDA document, drop it in this square, and they'll render it for you. They offer a variety of renderings. So I make sure that they know every time we have a new style sheet upgrade that comes along, so they always keep up with the latest HL7 offered style sheet. They took the 2016 ONC winner application and built that in as an option. It has all these tool control panels. You can hide sections. You can change the order. You can move things around, save your preference so that the next time you open a document, it's persisted to open that certain way. They got a lot of mileage out of that reference implementation that was made available to the whole industry. And I called them up the other day and said, hey, I'm doing this talk at the IAT. The VA offered a cool new style sheet that they were willing to share. Can you demonstrate how easy it is to do something like this once the sharing starts to happen? And they said, sure, no problem. So there's now a VA style sheet. It has some issues. The VA has these buttons up at the top that are supposed to like light up to tell you which sections are present in the document, and they didn't get that part working. I don't know if it's not possible in the way they implement it or whatever, but there was that was a hiccup. And then this style sheet was challenged to show subsections. So I used our discharge summary document from the work with the guys in Texas who wanted to order their sections and then subdivide them to make it clearer what's labs, what's radiology, and what's other type of results, et cetera. And this style sheet couldn't handle that. But it just demonstrates that if resources became available, free to use reference implementation stuff, the ONC, if they were to sponsor something like this, could be driving more rapid, more acceleration around even going to compare CDA documents and FHIR documents, which again will help us with this transformation that we need to go through and with making sure that we aren't getting out of whack with different vendors translating to FHIR in different ways. So I think that's kind of the ask and the challenge. It's something that the CDA management group continues to escalate as potential needs through HL7 consideration for ONC to think about how could they partner with us to help something valuable happen, and a rendering challenge maybe in 2025 would be amazing. And we got a lot of good starter ideas today. I will make sure to send this along to Al Taylor. They've got the notes and the recording and stuff. Thank you for your ideas, and we'll continue to push for it. Any final comments?
All right, thank you, Lisa. It was an interesting session. We're now at break, 45-minute break. Get your cookies and your pastries and your drinks and what have you. And when we come back, The ONC will be around, and we've got a brief presentation from them, and also Ask the ONC. And luckily for the ONC people, Sarah and potentially Matt, if he joins, we kind of preceded some questions for them, but there'll also be other questions that people will be able to ask. So 16 minutes away from now, away, and then come back would be great.
And how many minutes?
16 or 45.
okay. I thought you said 45 minutes before. I was like, what? That doesn't sound right. Okay.
Thought you said how many mats? Like 45. I didn't see that many on here.
We're basically, are we all a Matt at deep down at heart?
I like that. That's a very good perspective.
Is there anybody still on the call that could take a look at if I shared my screen to see what's going on with my Java? I'm trying to still figure out whether I need something installed or if I've got what I need and I just don't know how to use it.
I'm not sure either. I don't know.
It seemed like there were a couple, maybe when they get back from getting their cookie and taking their break. That might
Mhm.
be
Over here, Lisa, if you want to share your screen or something.
Oh, awesome. Thanks so much. All right, let me just figure out which.
Isn't the easiest thing to do first is just like a Java-V and see if she's got it installed?
Yeah, yeah.
Oh,
Right,
Matt,
me.
never mind. I'm stepping back into the background.
Okay. I don't know. Let me I just want to I want to just be careful what I'm showing on my screen. So I'm going to turn off all my email and all that stuff. Hang on. I think that should be safe. Now share my screen. So I just went down here, Matt, and typed in Java.
Yeah, so open
No,
up.
but you want to bring up a command line. You don't want
Yeah.
to do it from there.
Yeah, so
Command
type
line
in,
prompt.
like, instead of Java here, type in like PowerShell.
Oh, I'd do CMD.
Fair, fair.
I'm not going to have PowerShell
Fight.
command prompt. I'll just
Alright.
do Java space -v.
No, not
Or dash version or something.
it might be the dash version, you're right.
You do have Java installed because that's otherwise it would have said what.
Yep, that's true.
Good.
So this part's good. And then I downloaded that CLI thing, that jar or something like that.
Yep.
So that's everything I need.
Yes.
So I did that and I put it in a directory and then I put my input file.xml in there. Oh,
Yes.
geez, I see my problem.
Download.
It was the dumb problem.
So should
I
I
made
do
the
that?
file name .xml and it got an extension .xml.
So should I take this and go put it in I made a directory for tomorrow's validation track. Should I put this jar file over in that folder?
Yes.
Yes.
Okay.
Is it safe to say that jar file is just like a console app?
It's not an app. You're going to run the Java console app and
Mhm.
point it at that jar file.
Yeah, and the jar file has everything it needs to do everything it needs to do.
Correct.
Yeah, it makes sense.
Okay, so then I want to go to.
And if you're copying and pasting from the slide deck, there's like a carriage return before the profile name, and it will mess you up unless you paste it into an editor first.
The action can't be completed because the file is open. Did I try to open it? How would I know?
Whatever use that you might have opened it with.
What would I have opened it with? Didn't try and open it with that. Okay. Try again. No. Close the file.
You could just re-download it and then try it again.
Okay.
If you get the website
Can't
where
remember where I got it from.
we'll find it for you real quick.
Validator.fire.org.
You download the CLI right there, huh?
Yeah, they have a link to it.
I think right there. Download the latest CLI. Thinking.
Downloading.
Yay.
Don't click on.
Don't run it. Don't run it. You got to go to the directory. Just go to the directory.
It usually, I think it's not quite done yet.
It doesn't look like
It
it.
usually looks like this.
You got to click on that.
It's got to scan it.
Yeah, it's not quite done.
Okay.
Okay. That's the same as my file size, the 208.
Okay, so now this one I haven't opened, so I'm only going to.
There's
No,
the second one.
Second
you
one that
didn't
you haven't
open.
opened. Yeah.
Oh. Shoot. Cut this one. Okay, and then go paste it.
It does take a while to run it, doesn't it?
Here. Okay.
But you're running it. Is she running it from a command line?
She's gonna have to, yeah.
I just copied it.
Okay.
It's, so I just put it where I wanted it to be. Now, what do I need to put an XML file in here?
Yes.
Yeah, drop an XML file and I'll try to give you an idea for a line that might work.
Okay, so I have, this is the discharge summary that I've been working with, so I want to use that one.
Probably
Can you
want to
just rename it input file? Yeah. Make it easier for your string.
Input file, with a space or without?
No
No
space,
spaces.
capital F.
Okay.
And
No.
is she going to do the same thing? Is it going to end up XML.xml?
No.
Okay.
Jar
I want
files,
to get rid of the one on your
Yeah, you
jar.
got to change the name of your jar file. Get rid of the space dash. Yep. Boop, boop, boop. There you go.
Does everyone think that one might work if she navigates to the directory?
Yep.
So the easiest way to navigate to the directory from a command prompt is probably to click up in that bar at the top that says Lisa's Nelson's non-shared workspace. Don't click on any one of those. Click right at the end.
The validation track.
Yeah, validation track. Don't click on validation track. A little bit more to the right. Oh, no, but before, there you go. Click right there. Copy that.
Mm-hmm.
And then go back over to your command line or your command prompt if you still got it open. Or did you close it? All right, you might need to open up a new one.
I got a faster way, but I'll let you go.
Well, I don't know. I mean, do you have the right click with shift? They turned that off in the recent versions of Windows.
Did they? Oh man, I have not gone to 11 yet. I thought it was like Windows right click.
Yeah, you got to shift and then right click. But all right, so do CD space and then do quotation mark.
CD.
CD change directory.
DD will wipe your disk out.
And then you can take that thing in there, Control B. And then another quotation mark. Hopefully it works. Hit return. There you go. Now you're in that directory You should be able to copy that thing that says java-var validator_CLI input file.
In the
XML.
chat,
It's in the chat, but I don't know if you can copy from the chat anymore in Zoom. They kind of started making it hard. It's like a Zoom setting, I think. So sometimes you can, sometimes you can't.
Copy, I'm looking for it.
John Demore's comment where he had java-jar validator.
Yep.
So
Okay.
just that the line that just starts with Java.
Okay, and then do, well, that's not going to be enough because it doesn't know anything about, you have to do dash, so space. No,
Yeah, you'll need a profile.
dash IG,
Dash IE.
G.
IG.
Uh-huh.
I'm just getting
Space.
what's
Then what is C-CDA, right? It's going to be CDA-C-CDA. No, what is it?
It's this. I will put this in the chat. Oops.
There you go. Yep, that looks good. Benjamin's got it.
Yep.
Or whatever profile you actually want.
Yeah, try that one. See what happens. What is it? Does it give an output?
Ooh,
Oh yeah.
You watch my demo, John.
Paste decorate, it's got multiple lines.
Away from part of it.
You had grabbed too much, but it's working. So it's, yeah.
Yeah.
Takes a while.
So you might need to do that again without the part after per.
Yeah, just hit enter because you copied in multiple things. So just hit enter now and do it again.
Hit enter.
So this is where it has to download the, or not download, but load the dependencies. So Fire
Well,
and CDA.
Probably
and
downloading them too if she's never done this.
Yeah, no, it's
just
downloading.
did.
Mine is still going and I started as soon as I fixed my file name.
So
John, if I'm taking up, I mean, Jean, if I'm taking.
No, you're
up
not. We got 4 more
time.
minutes.
Okay.
I do. John Demore did put a thing in the chat. We do want to let people know that the CDA in its original format is being balloted in this ballot cycle. So it's too late if you haven't signed up, but he did put a link to it. So you can see it's the original CDA spec, but in a web version, instead of having to download and unzip and then view it that way, it's available with online navigation. And that'll become the new. We had balloted 2.1, so 2.0 went away at ANSI, and so this is bringing 2.0 back, but in a in an online navigation format.
Is that the last link that John posted?
Yeah, I just posted.
Yeah,
This
he
is-
reposted. Yeah,
And
This
that will be
this
the
is 502 bad
ballot
gateway.
version, Matt. That'll be the ballot version. So it's got to go out to ballot. Hopefully it will ballot cleanly and then it will turn into a normative published spec and you'll get a different link to it in the future without 2024 May on the end of it or something.
It just said bad gateway right now currently.
Does it really say bad gateway? No,
Mhm.
for me.
no,
Let me try it in
didn't
a
for me either. It said
incognito.
bad gateway.
Let me try. Nope.
This is a one-time thing that I have to go through. The
Yeah,
install.
well, it loads it every time, but right now it's downloading them. Oh, the HL7.org website's down. That's why it says bad gateway.
Okay, cool.
The weird thing is, oh, maybe am I stale? Oh yeah, I'm stale.
Yeah, it might be cached.
Refresh, it went down.
I haven't gotten that link to work. You told me about it, and I've never been able to actually get to it.
I got to it when I pasted it in like 20 minutes ago. So the 502 error just came up in the last 10 or 20 minutes.
Yeah, I've looked at it.
I have 2.
That's not good that HL7 went down. Should we tell someone?
Yeah, I'm sure
People
that's
know.
we
I'll
have
play
HL7
around.
We have
people.
some HL7 people on
Yeah,
the
we
call,
have
don't we?
HL7 people here, so
Yep.
So, but once this is all installed, where's it installing it?
into your
In that
package cache.
folder?
You know, it's hidden. It's in
Okay.
your user directory hidden.
Okay.
And so then the next time it's not going to be downloading it. So it'll be quicker because it's not downloading every package.
And then didn't Benjamin say the first time you run it, it loads like all the vocabulary and stuff into memory, but after that it runs fairly even faster.
No, that's if you run. Well, yes, if you run it in watch mode. So this just runs and then stops, and then when you run it again, it's going to do it all.
So
The
is
second time, if you do it with watch mode, then it takes this a little bit of time to begin with, and then just sits there. And then as you change files, it will automatically validate them.
And
So
that was that last extension I put on, right? The watch mode is what you're referring to? I mean, the last option,
No,
parameter. No?
No.
Okay.
No.
What makes it watch mode?
it's a different parameter.
Oh, okay. So the watch mode, anytime you make a change to the input XML will
It automatically
rerun.
revalidates. Yep.
Got it.
What's the watch mode command for property?
What watch mode space single.
Can you
I
post that in
put
chat?
it that link that's in the invitation, it goes to a page and Benjamin's deck is there. That's how I found all this.
And again, all those parameters are documented on the, using the fire validator, whether you can find them or not. But I mean, there's a way for you to run this, against a directory of files. And then I think that's where that watch mode single versus, I don't know what the other options are. It's just, it's what I've used when I've been doing all my testing.
Benjamin, we crawl, walk, run, Lisa and I. So we're starting with the basics. And if you showed it and it worked, we know what's going to happen.
All right. Well, Lisa,
Okay,
we'll let you
I'm
run
gonna
that in the
stop
background.
sharing. Yep.
Yep.
There we go.
Mine finished, Lisa.
All
There's
right.
hope.
I'm gonna start sharing.
Yeah, Sarah is so yeah, thanks everyone for coming back from your break. And Sarah's here and she's with the ONC. And so I think they have a brief presentation and then some questions and then we can all pile on.
Let me try that one more time. Sorry about that. That was not the one I tried to. All right, I bet I need to switch my display, don't I? There we are. Did that switch correctly?
Yep.
Wonderful, thank you. Right, we got lots of great questions sent in ahead of time, so I'm going to do a brief what's new with ONC before we jump into all the questions you sent in and additional questions that you want to add to the chat. You can start adding them now as I'm talking, or you can hold them until we get to discussion at the end. All right, what's new is a recently released HTI 1 final rule. This rule implements provisions of the 21st Century Cures Act, and it makes updates to the ONC Health Certification Program. The rule provisions advance interoperability, they improve transparency, and they support access and exchange and general use of electronic health information. These provisions include a discontinuation of the year-themed editions. This is going to allow developers to update standards in a timely manner. It also reduces the potential confusion of tracking different editions of certified health IT at once. The rule also establishes clearer timelines for adoption of standards, another thing that can reduce confusion. And it's also going to help align different programs and the timing of those program requirements. The rule also adopts US CDI v3 as the baseline for certification. This adoption date is January 1, 2026. And the affected health IT modules for certification are listed here. These are the ones that will be updated to US CDI v3. Speaking of US CDI, what's new with US CDI? So our US core data for interoperability is the core set of data needed to support patient care and facilitate patient access using health IT. US CDI establishes the baseline set for other use cases. Why is this important? So ONC Cures Act final rule established US CDI v1 as the replacement of the common clinical data set. And as we just saw in the previous slides, HTI1 adopts US CDI v3 as the new baseline for certification. Also, other programs use US CDI in requirements, programs like CMS Patient Access and TEFCA. What do we have new in US CDI for draft v5? We have 13 new data elements listed here. And we also have 2 new data classes. And earlier in the day, Brett and Gay walked through these new data elements, and we discussed most of them and how they are reflected in C-CDA. I think Brett called it a way too soon reflection of draft US CDI v5, because like I said, this is the draft, and we anticipate the final US CDI v5 was to be published in July. So our comment period on the proposed new data elements for draft v5, as well as existing data elements, closed on Monday of this week, so April 15th. And that feedback that was shared during the comment period will be considered as ONC develops the final version of US CDI v5. Some of the priorities that we also consider, in addition to community feedback, when we're looking at new US CDI data elements, include inequities, underserved communities, behavioral health, public health, additions to US CDI that make it the complete baseline set. Also considering burden for implementation, and along with that, the aggregate lift for all data elements together. Where are we in the US CDI timeline? besides just the comment period closed on Monday for draft B5. Here's a big picture look of where we were in 2023 and where we are in 2024, including that we predict that we will publish our final V5 in July and update this cyclical image to reflect V6 because our anticipation cycle for submissions for V6 opens up as soon as we publish the final V5. So how does our US CDI update process and the SVAP timeline overlap and correspond? Here's a timeline that will take you from draft V4 all the way through the anticipated V6 and how those dates and periods overlap. For more information on these pieces that we talked about, you can find them at these links. And of course, we'll be providing a copy of these slides for everyone to access. All right. Moving into our Ask ONC section, I told you we'd be saving most of our time for our questions. Thank you to those who sent in questions ahead of time. I did pull those off the Confluence page and put them up here so that we can all see and discuss them together. And we're prepared to discuss those and answer those questions for you. I'm also going to take a pause and make sure that I can see the chat and the raised hands before we jump in. And I do have Matt Ron and Al Taylor and my other ONC colleagues here to help me with the questions as we dig in. So ONCers, if y'all want to unmute and chime in as we go. I just lost one. There we are. Apologize for that. All right. Kicking us off, what is ONC's plan for updating the scorecard validator that validates the CDAs with PHI? Can you make reports identical to the non-PHI scorecard tool? And I think Matt is ready to chime in on this one.
That's fine. Was this from Linda? Who wrote this question?
I think this is Lisa. Lisa, is this yours?
I
Lisa,
wrote it on behalf of Rochelle.
Oh.
No, seriously, I am interested in this too.
I know, because I think you brought this up a few times. So this is something we can look into. I think, you know, one thing, I know there's been some, we've talked multiple times on this about this particular thing, and then other, like, how do we get updates to the scorecard? One thing that would be helpful is if we updated the rubric, that would kind of help us with, you know, making sure we had, thinking about how we provide resources to make updates to the scorecard. That would be helpful. For this one, I know I said we could look into this regularly, but I'm happy to work with you, Linda and Rachel, to see what we potentially could do to make this more useful for you and your teams. I do want to say, like, from a resourcing perspective, we'll have to look into that, but most likely, you know, I've said before, kind of the reasoning why we've had the differences in I think it's mostly been around different audiences, but you know, if you're talking about the ones that like even if you locally installed and you're still not getting the particular data that you want, happy to figure out how best we can do that. I know that there's an interest to have the one-click scorecard also get the same report, or is it the other way around, Linda?
It's the direct, the one that you can put PHI into. So the direct one. And I think I read in CMG that Jessica tested this and has the current status of
I see Jessica had a question too. So I did see that. And did you send I think you sent us the or did you submit a ticket, Jessica?
I haven't yet, but as I was typing that question in chat, and Lisa asked if I was using a direct address, I remembered that I was using an eval address. So
you
I tried that again real quick with
Thanks,
production.
Lisa.
So maybe, thanks, Lisa. And
it's a trust bundle thing. You have to give the right.
So stand by.
Let me know if you're still having issues in that sense. But Linda and Lisa, I'm happy to look into how we can make that more useful, especially if it's like if we have the resource to do it. I think that's something we can look into. However, if we were going to be, one thing that makes it a little easier on me is like if we made if we made some updates to the rubric. I know there are probably some things that have happened in the last, I don't know, when did we do the rubric, like 4 or 5 years ago? There's probably some things we can add there. But one plug I'll say is like maybe we make it generic rubric. I don't know, maybe have the conversation of having it generic, not specific to C-CDA.
You mean not specific to CCD?
Yeah, well,
wouldn't the broad ask just
I'm
be
saying
like don't
so
make
maybe we could utilize it for potentially fire too.
Yeah, don't make two different reports. You know, let's just the difference is we want to be able to examine the content and get the scoring and everything. Just don't make 2 different reports. Make one through the secure process. So if the document has PHI, you have a path you can send it. And if you have just a test document, you can play around, kind of, get your feet wet, figure that out, using the scorecard that you can just submit to, but keep the reports the same.
Okay, send me an email directly. Now we'll look into it with
an
your
enhancement feature.
Your recommendations.
An enhancement feature would be nice if when you locally instantiate it, you could run it for several files at once. Because as you're looking at the people sending you data, that would be very useful. I think we've already done some of that ourselves, but it would be, when you're trying to connect with somebody new, it would be really useful if you knew how quote unquote good their data was.
Okay, sounds like, Linda, we should put a joint mail message together and then send that to Matt as a follow-up on this.
Sure, Lisa.
And then
be careful what you ask for, Matt.
If you don't hear from me by the working group meeting, you can come up to me directly in person.
Great. And I like what you said about that there might be some possibilities for fire documents as well. So we'll keep that in mind as that's a really good idea. We'll include that in the mail message. Sarah, are you like reading the items as we go, or is that how we're moving to the next question?
Yes. Yeah, and it sounds like we're ready to answer the next question. And Lisa, I think this is yours. I think you're asking about value set changes. You said other than, I think you mean other than the revisions to the OMB statistical policy directive that was announced recently.
Yeah, I mean, do you see that, like, are you guys really going to change race and ethnicity? And if so, when and how? I mean, this is like a huge, huge change. It's not just a technical change. It's like we have to change how things are done in the whole United States in so many places. How are we going to do this?
Yeah, understood. So
we're,
go ahead. Sorry.
yeah, sorry. No, we're aware of, you know, potential, we're looking into any potential implications. You know, we do have 18 months to come up with a plan that we must make public, and then up to 5 years to, you know, enact the plan. But, you know, essentially, I think there was like as of, you know, March 28th is like, you know, we needed to start thinking about how, like, any data collection, we would start collecting, you know, using the new OMB, I think they were calling them like ethnicity, but race and ethnicity codes. So that's something we're looking into now, and like making sure we can see the big picture. Every agency has the same requirement, and so there is some you know, work that has gone on and that will go on to kind of and on us to coordinate related to how this data is collected in the future. So
does this rule say by when we have to adopt it?
Yeah, 5 years.
5 years. So
5 years from March
when's the
28th.
next census?
6 years.
But it's about federal data collection. So it's, I mean, that plan would probably include federal data collection for the census, which is the plan will be implemented, and it'll be if for the census, it'll inform the census probably. But obviously it's not going to be performed by then, because that's not when they do it. That's just one of the many federal data collections that this impacts.
And
right.
CMS.
I'm just thinking that, you know, think of all of our quality measures are stratified on these fields today, you know, and then as soon as you disrupt your basis for comparison, we finally are in a place in the world where in the United States, where we're worried about social determinants of health and equity, or however you want to, what is the right term for, you know, problems associated with inequality. And in the midst of all this, we're going to decide to disrupt the data points that we use to keep our bearings on whether or not we're making change that makes things better or not. It seems like a really crazy time to make such a big change.
Part of it is to address those inequities, and this is a way to improve it. You know, they have one of the key features is that they have large swaths of the population that simply don't answer the question because it doesn't apply to them. Like, are you basically it asks, are you white for Latinos? And like, that's what they're supposed to say if for race, and then for ethnicity, then they say what kind of Latino they are. I mean, that's the problem that they're trying to address by doing this.
Okay.
Can in addition to that, will they continue to collect the any of the detailed classes, or is this the one and only?
Well, remember, those are the general ones. Those are what we used to call the
Categories?
OMB5. Now it's expanding. You know, it's expanding beyond the 5 race categories and the 2 ethnicity categories. The expanded version, which is the one that correlates to the CDC race and ethnicity standard, that you know, we currently have in certification. You've got a map from the OMB5 to the CDC 900. At some point, the CDC is in the process of revising that standard too, which is separate from the SPD 15. But we currently say in certification, you've got to be able to connect the race and ethnicity categories to the race and ethnicity details. And so I can imagine, you know, there's no promises, but I can imagine that we will have to be able to link the new race ethnicity codes to the new, soon to be new, detailed race and ethnicity codes that CDC is going to be putting out.
It's 6 o'clock.
Is
Okay.
there any map that exists yet? I
Well,
thought I heard there was one for that, just for the categories or the higher level.
the category to what? Do you talk about the categories to the 900?
The category to the current category. So right now there's, Hispanic, non-Hispanic, and then the nulls, and then the, what is it, like 5 race codes and then 3 nulls?
Yeah, they published. I haven't dug into the details of it, but they do publish the new ones. They have the old ones. I don't know for sure that they specifically map. But there's a new category of Middle East, North Africa is a new, what used to be, it's a separation of from white. And so that's a new, what would have been a new race category, but it's not a race category anymore. It's a race and ethnicity category.
It sounds like it's going from the top 5 or those main 5 to all the options that exist under SDTC race code. Is that safe to say?
Well, it's new. There are some changes, and it goes so there's some sort of mapping that could be done between the existing race codes and the existing ethnicity codes to this new set.
Okay.
So it sounds like Al, like there's more work to come, and we've got
Yeah.
5 years to get it all together, and maybe it's a great opportunity. We're challenged right now because so many groups were doing something very different. So maybe the real opportunity is that when this is introduced, it will be well understood and everybody will do it the same way.
If wishes were horses.
Yeah,
It's a
I
great
mean,
idea.
We
It's a
have
great
5
theory.
years. It could happen
Yeah,
sooner.
5
Just
years.
a
Yeah.
heads up. It could be sooner.
Did the CMS rule that came out that you don't have to use it for that, do you? Their diversity and inclusion.
And if you think about what the impact would be on ONC certification, the timelines, that's pretty close to what the normal timelines is for changes in certification. With starting with proposal versions, periods. It's like that's it might be tight to actually get them in place a lot of time.
Al, I think you were breaking up just a moment. Do you want to repeat that?
Oh, I would just, okay, sorry, yeah, I got the little note that my internet was unstable. So I was just saying that that when you think about the 5 years, on the surface sounds like a lot of time, but when you think about the change on certification, that's
we're losing
that's
you.
gonna
Want to just put
require
in the chat.
Now you think you're doing it on purpose now.
Yeah, he's just saying like the timeline can be similar to how we do
Yeah.
certification.
Right. Yeah.
All right, let's make sure that we leave some time for our other questions. Can the ETT be extended to support more types of C-CDA clinical note document testing rather than the data in CCD? We do have Aaron and Ashley on the phone if you want to chime in.
Sarah, this is Lisa. I'd like to open this question by explaining that in CDA, document templates, and certainly in consolidated CDA, the document templates are open, which means that really it's the question is asking, can the ETT be modified to validate more document types? Meaning, if you get a template that says, oh, this document is a operative note, that the validator would know how to validate an operative note. But that sort of assumes that knowing what an operative note is already kind of prefigured out. And really, the better thing is there's a bunch of sections. And those sections can be used even if they're not called for. Yes, you have to, for a certain document type, there's certain sections that have to be there, or certain sections that should be there. But all of the other sections could be there. And really the ETT, like the design approach, needs to be more like, I'm processing this document, and as I read it, it tells me what kind of document it is. Well, let me validate the header according to that. Let me make sure that it has the required sections. But then as I march through this document, if I run into a assessment and plan section, I should know how to evaluate an assessment and plan section and do it because it's in this document, whether the document called for it or not. Validate a plan and assessment, assessment and plan section. So make the ETT validator flexible enough that it can validate whatever is presented to it, as opposed to the way it works today.
Yeah, so I mean, if you had a valid document type, then it should test it. But I put in the chat, but I think you're talking about for the C-CDA validator, that's not the edge test tool, because the edge test tool will be specific to what's required in certification. So it would just test the C-CD discharge summary and referral note. However, if you were using the C-CDA validator, it would be able to, and you had like a document template ID that was valid, it should test it.
And would it test sections that aren't called for by that document, because it's an open template? So if you added an extra section in, would that section also be validated?
I mean, we're for the validator, I'd have to double check if you're talking about additional ones. I don't know if Brett's on, but you'd be able to answer.
I think the request would be, can it make sure it does that? Because it's hard for someone to understand that, yeah, some of your CCD is valid.
If Ashley or Aaron know, that's fine. We can look into this. I'll let them answer though before I continue.
Hey, this is Aaron. No, I don't, but I think it's something to bookmark. Ashley, were you chiming in to say something?
No, I think I was going to say the same thing as you, that we will definitely take this back and look into it.
Yeah, I mean, if you're just looking to if you were adding like sections and entries and you're looking to see if it was valid, I don't see a reason why I wouldn't tell you that, but if it doesn't, we can look into the C-CDA validator doing that. The ETT is definitely, as I said, is specific to certification. So it's not required in certification. I don't want to recommend we put it there.
Makes sense. And that would be great if you can follow up. So the right thing is to just, what's the right way to reference the other validator that's not the ETT?
The one on site, you're going to say
site.
Yeah.
Thank you.
Okay, on the kind of along the same lines, for the specificity of added notes for ambulatory EHRs. Will there be consideration for ONC testing? Perhaps consuming the data, not requiring output of this, if never consumed by a third party. Kind of, along those lines, if it's required in certification, there's no exemptions in testing that forgoes support for USCDI data element. So if USCDI V5 were required for certification, then support of those data elements would be required. And I'll pause for Aaron and actually Matt to chime in.
Who asked this question? Can you just
Rochelle did. Rochelle asked the
Rochelle,
question.
will you clarify your question? Just what do you
So
really want?
the new in USCDI V5, there is the emergency, the ER note, right?
Yeah.
That's going to be really tough for a lot of people to even understand what goes into that note. I understand needing to consume it, and then I guess if you're consuming it, you need to spit it back out. But there has to be a good bit of guidance around that for non-ER EHR systems to produce that type of note. And to make that required seems.
Go ahead, Al.
Yeah, it's not. So you touched on it at the beginning of what you just said. The requirement will at least be able to consume it, because if somebody's exchanging ER notes or op notes or progress notes, you have to be able to recognize them as such when you receive them. So you may never produce one. You may pass one along that you received from someone else, but you have to be able to consume them, not necessarily integrate them, but receive them and recognize them as an ED note. And there's a lot of other examples where inpatient only EHRs, outpatient only EHRs have to do things that are only like discharge summaries. Ambulatory EHRs never produce a discharge summary, but you have to be able to receive a discharge summary, because you're going to be getting patients from inpatient.
Yeah, I'll just add.
Right. I think the main thing is, how do they render that properly in their EHR system once they do consume the data, so that they're making sure that note is displayed as it should be for someone that doesn't create it to consume and then display it. Could be a little tricky. I know they don't have to reconcile it, right? It's not part of reconciliation, but just something to consider, maybe additional guidance around that as we talk about these specialty. Discharge summary gave the ambulatory environment a hell of a time. So just want to throw that out.
Yeah, well, it seems like as long as the tag, as long as if the lowing tag is preserved, the lowing tag is what identifies the text blob if it's a narrative, or a note type, document type if it's structured. That tag, that the lowing tag is going to continue to identify it for as long as that tag is maintained.
Absolutely. Yeah, no, absolutely.
So if you were to incorporate it, then that kind of breaks down that text blob. But if you preserve the text blob with the tag, then you should be able to reproduce it.
Understood.
Yeah, but just as you know, it is draft. USCDI version 5. We just got the comments Monday. We're going through all of them. Al, how many were there? I heard almost. Al, are you still there?
I am.
How many comments were there, Sarah or Al?
Well, there's over 600 comments. We got 420 some comments, including 75 comment letters, which had multiple comments per. So we're looking at around 700 comments for V5, for draft V5.
So Rachel, I hope one of those comments was you providing feedback on this particular
I
bill.
can tell you the one we've already gotten
I
that
did
comment.
not directly, but EHR did. Okay.
I have already seen that comment come across. In fact, we get the comment every version of USCDI. A similar
And I
comment
think if
every
the
version of
ACDs would
USCDI.
explain it that way, the way that y'all explained it, like it needs to just be, you don't have to produce it, but you do have to be able to spit it back out, right? And so I think that's really important to cover it that way. And I don't know that that's being done because it's always a point of contention.
What was describing it differently?
The concept of you're going to have to accept it and then you will have to return it back out, I think is a good point. And that's what we always tell clients, but it's important for ONC to say that. Like, we understand you're an ambulatory system and you won't be capturing this data, but you're going to have to pull it in and push it back out. Right.
And we have said that in the past on similar topics. And
right.
And you know, and
like immunization.
Yeah, I mean, yeah, so yes, I mean, we've tried to, as far as I know, we have not changed that message in 4 years. Because the question about ambulatory only or inpatient only functions documentation, that's always there. That question is always there. But the fact is, we have one certification rule. We have one set of certification criteria for base EHRs for all
yeah,
agents.
But like V1 of ONC certification requires you to create specific documents, and y'all do only make inpatients create discharge summaries, which makes complete sense. So my question was around EHR that does nothing with emergency room software. Are they going to be required as an ambulatory system to create that? Because y'all don't have a division between inpatient and ambulatory, right? I mean, EHR. So who's required to create that document in the test scripts if B5 is part of testing?
Well, B1 is not necessarily going to add new note types. There's 3 note types in B1. Those are not the same as USCDI clinical note types. Not the same thing because but
that does go in the CCD, right? The US
can go into CCD. That information can go into CCD, but the USCDI data element does not designate a structured document.
Okay, so that kind of answers the question we had earlier today that Brett was covering as far as the document versus the section. I think.
I mean, yeah, whether or not to design this as a section in C-CDA, that's a design choice. It's not, you know, it's not our intent that it defines a complex structured document. We're trying to capture the context of the emergency room in a narrative.
As you would do a procedure note under an encounter in a CCD, I'm imagining. Similar concept of putting it in the actual document as a note section, not a complete document itself. Correct?
Well, I mean, we don't specify how C-CDA does it.
Well, the test tools do.
Yeah. Well,
so that's the question, right?
Yeah, I mean, what they would, yeah, and I apologize. I'm not familiar with the exact way that they test for each of these clinical note, the USCDI clinical note types.
Sure. So that's FHIR and CCD both. I mean, FHIR and C-CDA both test it within the CCD as a section using the LOINC code, and that's how the test tool tests it.
Right.
So what I'm asking for is for more, if we're going to require that, maybe some more education around that, because the test tool's testing something that ONC isn't laying out as the requirement, except for in the test steps, right?
Well, yeah, but the test
to bring it to your attention.
Well, ONC lays out that the test is against US Core and C-CDA. that's the other thing USCDI require. I mean, ONC requires is that you have to conform to US core and the CCDA, and the test
Yeah, I
tools
think we're
test
kind of
against that
talking around
conformity.
each other.
Yeah,
I think we're just kind of talking around each other on the situation. So I can send an email.
Yeah, please send us a note, because I'm not sure I totally understand where you're coming from.
I'll send examples with screenshots. It'll be fine. We can follow up if you need to after. Yeah. No.
Yeah, I was going to say the same thing. That would be great with examples and screenshots, and we can take that back and yeah, review our approach or, you know, any responses.
Yeah, we have a couple of years
more
before we
examples.
have to really deal with it. Exactly. Thank you.
Thanks for that. Now we can talk about, can ONC update the test patients and testing to include stories with multiple encounters with clinical notes to accompany each encounter?
This is my question as well. This is Rachel. The stories haven't changed in many years. We just keep adding new data to it. But the concept of a longitudinal CCDA or a CCDA that's a summary of care, testing the ability to reference the notes to the encounters or connecting the information in the CCD seems to be something that needs to be tested to ensure that CCD remains interoperable, or CCDA, either, you know, it doesn't have to just be the CCD. But Examples Task Force has addressed this through HL7 as well, but it's not being tested, so it's not being implemented. And they're just doing it various different ways of putting the notes in for, so you may have multiple encounters in your CCD or in your CCDA, but you don't have a proper way, or they're not properly allocating the right note to the right encounter. And so the test school could give if the story could give an example of that. A patient had a visit, their consultation note was XYZ. A patient had another visit, the consultation note was, so that we have an actual longitudinal example of how this should work.
Yeah, thank you for that. We'll make sure that our testing and tools team gets that question. I think that maybe they dropped, but I appreciate that question.
That's fine. Yep, Rachel, send us your wish list and we'll see what we can do for you.
Okay, thanks so much, Matt. I'm just trying to make the CCDs and CCDAs a better implementation for interoperability. And if they're not forced to do it by ONC, they don't do it. So not everybody, but the majority.
Our next question, Lisa brought up in her last session, right before this presentation, but if you didn't get a chance to listen to Lisa's pitch for another rendering challenge, Lisa, do you want to chime in with that again?
Well, sure. I just tried to demonstrate that there are folks out there today in small groups, in big groups, from like the folks in Texas, the folks at the VA, the folks in the data usability taking route, who still feel like there are challenges in how we're rendering documents and are wishing for things to improve and get better. And the 2016 rendering challenge was a real benefit. It accelerated improvements and helped everyone have access to smarter tools for rendering. And we're just wondering if it's even possible or on the radar, if you guys have it in your scope of things that you still do. Is it possible to advance conversations about a rendering challenge that would be modernized for 2024, 2025, maybe something that even pushes towards advanced tools that handle CDA and FHIR structured documents?
Appreciate you highlighting how useful the last one was and bringing up this question about future rendering challenges. And we'll take this and we'll come back to you.
Hey, Lisa. I think this is also something like maybe HL7 could possibly support as well. So I think that's
so,
a question for Dan as well.
We will continue to, we meet with him at every working group, and we'll continue to, kind of push up. If you guys could help push down, there's money. It's just a matter of what are the priorities to spend it on. And if this is considered something that would be really beneficial to the industry as a whole and was structured in that way, and maybe we could even follow the pattern that you guys set, with the guidelines and everything of how that challenge ran, and that the winners had to be willing to make their tools available as open source reference implementations. I think that would be great.
All right, the next question is a suggestion to reinforce the correct use of link codes for different document types. Another suggestion that we can look into. Lisa, do you want to expand on this one?
Yeah, there's a section that we're writing in the data usability guide that talks about effective use of correct coding in documents, and where so much of the industry has only really focused on CCDs, they only needed to know one LOINC code. But the question, even like that Dr. Grew brought up around more specialized, maybe a progress note that's relevant to eye care, or specialty types of consultation notes. I feel like we really are at a point where we need to establish what I'm calling the Dewey Decimal System for organizing documents, so that we could support and require groups of, I don't know what you want to call them, network participants like TEFCA, to use the same, to understand and tag their documents with the correct LOINC codes, so that we have a language that we can talk to each other and request documents in a general or specific way. So if I'm interested in progress notes of all types, there's a code that I can use to say that. But if I'm only interested in neonatal progress notes or ophthalmology progress notes, there's a way that I can say that. And right now, even within EHRs today, they do not require their customers to utilize the standards. So they're bumped up against all these local codings. And I'm just asking myself, how are we even making these networks work effectively if we don't get people to buy in that the documents need to be classified at the highest level using correct LOINC codes?
Yeah, that's a challenge. We don't have an answer for this one today, but I appreciate you bringing it up and highlighting the use cases. Our last question is, could the validation tools be more modular, so that they could validate a single section based on the template, rather than always having to validate a whole document? That's another great question for our testing team, suggestion for enhancements that they can look into that we'll bring back to them.
So I have to ask you, we were asked to submit these questions early.
Yes.
And we did. Did they not go to the ONC so they could come with answers today?
They did.
Okay.
Yeah, so sometimes we might not have an answer you want to hear. So I think there's sometimes where we'll have an answer for you, and sometimes we need more time to get a better answer than what you're looking for. I know, but I appreciate the fact that you all did send before, so we are going to send you what we can in responses soon after this. So I apologize that specific question, but we will at least get a response in a very soon time frame.
And I'd love for like Susan to get a copy of all the answers, because since they came up through the Connect-a-thon or Implementation-A-Thon, so she could, you know, aggregate them and put them, you know, as answers to people who are maybe heard the question on the call, but need a
Yeah,
follow-up.
I mean, some of the questions are also like things that I think the group can talk through, and not necessarily like specifically always an ONC answer.
All right, are there more questions for the ONC? We have a few more minutes left.
There's one in chat.
Thank you. Is that Jessica's question? Can the ETT be improved to show line numbers for all the errors found? Getting an error saying line number not available in a several thousand line document. Yeah, that would be challenging. Yeah.
I second that one, Jessica. Yeah, struggle to validate documents, or when you find a problem, it's sometimes hard to track down what the exact problem is without the line numbers.
We never land on the
Right. And just to add a little bit to this, because I have a feeling somebody's gonna have this as a response. In a lot of cases, what happens is you'll have an XML file that has an error on one line, but it'll trigger like 4 different errors. And one of those errors will have the line number, and resolving that does resolve the errors that don't have a line number. However, that's not always the case. And the fact that, and even then, if you have, you know, as happens with us, sometimes we'll be validating for a client and their document has 400 different errors and they're not all grouped together, and just even if they could be, you know, if the different error messages could even be somehow grouped to where like you have a handful that are all referencing the same point in the document, you know, something like that would even be helpful.
Yeah, thank you for that.
Yeah, Benjamin, yeah, that's a good point. Yeah, I see a few of those too. Yeah, when the XML document is actually one big long string, that doesn't help, you know, identify line numbers. But in the cases that I'm talking about, and I'm sure Jessica's talking about, that's not the case.
Yeah, and I'm going to push back a little bit on that too, because you're right. A lot of times it is a single line number, but there are, I mean, if you're in a position where you're testing validity of C-CDA XMLs, you have tools at your disposal to beautify an XML and break it up into several lines. I know Notepad++ is widely used. We have a ton of tools that, you know, that take care of that. So so you're right, and actually, yeah, your second sentence I do agree with. The XPath expressions would be useful too, but line numbers I think would still be helpful. Yeah, exactly. Oxygen, VS Code, all that good stuff. Yeah.
Yeah, agreed.
Thank you for the chat. We'll roll that into that question. We'll roll those 2 questions together.
Thank you.
I think we have 2 more minutes.
Yeah, Lisa put something, but I guess is that for the other comment, Lisa? Error messages need to be actionable. That's exactly it.
Yeah, I mean, when I worked on validators, you know, in the design of the validator, you need to sit down and go, what is the validator putting out? Will the reader of this error message know what's wrong and what they need to do to fix it?
Yeah.
Because at the point of writing the error out, logically, the program that's doing the validation knows what's wrong.
And Site does a good
And
job
to-
of that, because you can drill all the way down to the line number and see, you know, the data that's causing the issue. But it sounds like this other validator does not.
Well, the site,
and ETT
I don't
does
know if
not.
the site validator does it either, Jessica. I still have had issues where I don't always know exactly what it's doing. If it's got the XPath or a line number, it's easily fixed, but sometimes I still struggle.
Right, right.
The
And like
Lantana
just,
tool definitely does it, right? That's the one
yeah,
we go to, right? Is the Lantana tool, because ATT and Site don't give us what we need there.
right. I was just fixing to say that. Yeah, Matt posted the link to that tool in the chat. So it is possible. It
Oh,
is
okay.
they are
Yeah.
there.
Is that tool going to go away though now with the fire validator and maybe the fact that, you know, they're moving away from Trifoli and all that? Or will that
All the
one be
more
updated
reason.
as well?
All the
One of
more
our
reason,
concerns.
right?
That's a concern.
I think
Hey,
though,
this is
to
Matt.
be
Can you hear
clear,
me?
Yeah, we can hear you,
though,
Matt.
they
Sorry.
told us that for Lantana, it's only the fire tool that's going away, not the not
That's
their
true.
Yeah,
CDA tool.
well, yeah, but their CDA tool only produces PDF versions. It doesn't,
No, I understand,
yeah.
but
And
it's
it's only
not
gonna
like their
validate against-
entire tooling is going away, just the fire.
Yeah,
Yeah,
and it's only going to
Trifolia.
validate against IGs produced by Trifolia, not structure definitions.
Yeah, I mean, I think the overall point is saying, sorry, I'm on phone only now. Is, you know, we can definitely look at how, you know, we could improve our tooling if it's not already doing some of the, you know, things you've been discussing. I do think it does some of the things, but I'll just put a plug for Site is like for pre and post certification testing. So when you're going to ETT, like you should, you know, that's when you should be ready to you know, finish the testing part. But the tools are there to help for support, and if there are things that we could do that aren't like super resource intensive, that would be you know, that we could update the tools with, you know, we are definitely interested in looking into that.
All right, thank you. And thank you, Sarah and Matt and Al. And thanks everyone for those questions. I think in the future we'll continue to do that, get the questions in advance. So that ONC and team can provide answers where they have them, and at least know what's going on. So the next is for me to do a little wrap up before we come back to tomorrow.
Thank you, everybody. Appreciate it.
So yeah, in the last 15 minutes, we've got an update on the action items from previous IATs, wrap up for the day, and then I'll go over what the plan for tomorrow is. So we had from prior IATs, we had 4 action items. We're still tracking them. So there was follow up with Direct Trust. Lisa has reached out to Direct Trust asking if they have materials to share. So we're still waiting on that.
I actually heard back from them, John,
yes?
this afternoon, and they said, no, we don't have anything yet. So I suggested what they could create. I'm working with them on another implementation guide that explains the different formats of their direct messages. One carries an XDM package and one does not. And I suggested to them that we do, they do a nice job of creating little like 1-pager, 2 sides, infographic kind of things. And I suggested that we pull some of the material out of that IG and build an infographic with it. And they're open to that idea. So I would say it's not closed, but there's an idea for how to make progress.
Sure, perfect, thanks. Adding more detail to the one-click scorecard. So we're going to close that. ONC's working with Linda, or will work with Linda and Rochelle to determine what's needed. And we heard some more conversations earlier about that. We did have a conversation with Russ around the dental CDA AIG. I'm going to reach out to him. He asked a question in an email, so it's still being determined. I think it should be listed. It's not like some of the other supplemental guides, but it's very much like the eye care guide, where it produces some templates that can be used to convey dental information, but within any other CDA document. And yeah, and then the last one is the subsection approach. So Lisa's going to raise some JIRA tickets. It's unfortunately too late for this version of C-CDA, but for future to talk about some subsection. We did get some information on subsections, but obviously I think we want some more in there.
Were there no tickets? I was trying, John, were there no tickets? I can't believe I just completely spaced. I got all of their other tickets, everything from Texas, you know, that they wanted in terms of including certain sections and, you know, making sure that the discharge summary got those improvements. And it's possible that I didn't say anything at all.
Oh, we did, right? There were two different tickets on that had guidance on the use of subsections. So, I mean, you may have already done this one, right? We
But
did add,
anything get into the
yes,
guide? Oh,
yes.
okay.
In chapter, in the design considerations, use of subsections.
Oh, great. All right. So then I think that's closed.
Okay, we can close this one.
Yeah, but I will, for the future, Ben gave me a specific suggestion on a JIRA ticket that of how you could actually make the modeling in a template express that. And I'm going to put that in for the future, but I think this one can be called closed.
Okay. All right. From today, we had one action item, which is, you know, when we were reviewing the C-CDA, Benjamin and I will go through and potentially fix like the names of the invariants, just so they're a little clearer. And we'll also have some other issues. I already fixed the death observation. It now has the fixed code in it. That's one of the beauties of this new publication format and format we've got, is that we can make changes much quicker, obviously.
I fixed the issue I saw in health concerns, which I didn't even tell anyone about.
All right. John, did you think there would be something small that could be done to make searching by template ID possible?
I still have to figure out how to do that, or where we're going to do that. Like, it would be nice if that artifacts index page could include the template.
Uh-huh.
But it's not. It has a name of the template and the description. That's what that page has. In groups, we don't have, so we'd have to figure something else out, but we will look at it. And that was it. So that's all we had for action items for today. So then we'll talk about the schedule for tomorrow. So tomorrow, starting at 10 a.m. Again, I mentioned this morning, but we've got ID in a CDA document. So we have a brief discussion around ID best practices. Dee Dee Davis is going to be here to talk to us about the Sequoia data usability taking root, give us an update on that. And then we're going to do our breakout tracks. Basically, there'll be a brief, before we do the breakout tracks, there'll be a brief conversation around why advanced directives are important. I think we've got a couple videos to watch. And then we'll break out into the tracks. One where Benjamin's going to help everyone validate their documents. And the other track will be Lisa and others looking at advanced directives sections. So again, if you have some documents that you can bring and try them out with validation, obviously the validator works on the latest guide. So if you've got some old documents, there might be some concerns, but we can work through those.
I wanted to plug also for people who are deciding which track to go to in the advanced directives section. Even if you don't have specific interest in advanced directives, we're going to be working on how you generate examples for what the templates say that they can do. So I've identified 5 or 6 examples based on what these are new templates in Consolidated CDA Release 3. And I'll be taking the group through a process of how do you figure out what data needs to be represented for the particular example, how do you think about laying out the information from a narrative point of view so the humans can understand it? And then how do you move from there into what you code in the machine processable? So I have some examples that are already kind of straw men shaped up. So you won't have to be a heavy XML writer. You can be an XML reader. You can be an observer. We'll be looking for problems in my examples, fixing them up a little bit. And then the goal is to only use that first session to go through the examples that are available and then bring those examples back into the validation group. So we won't stay separate the whole time. We'll bring our examples and see if we can validate them and use those examples as what we bring to the validator track.
Cool. That's good. And yeah, does anyone have any questions about tomorrow or anything about today so far? As always, Jaginder's in the background taking notes, and we've been chatting on our side chats, so there will be notes for the various sessions. And we will be, yeah, that's all we've got. So thank you, everyone, and we'll see you tomorrow at the same time.
Night, everybody.
Tomorrow.
Good night.
Night.